Sure. Are we starting now?
Yes.
Okay, sorry. Hannah Eisner,
Here.
Cole,
Here.
Corey Tello,
Here. Here.
Judy Buchanan,
Here.
and Susan Schaefer.
Here.
Everyone is with us.
Great. So the agenda for today has two items. I think what I suggest for discussion, one is kind of the status of the RFP process and reporting. I think the Mental Health Advisory Board had some discussions on that. So I thought we could review the document as well as the process. And then the second is begin the discussion of how to handle the scoring of the applications as they come in. And then I won't forget this time when you have minutes to approve. So in fact, why don't we just bump that to the top so we don't forget it. I think we have minutes of our, let me get the agenda. What meetings are they, Amy? Remind me.
The
They're
June
June
24th.
24th and July 6th. Sorry, Amy.
No, sorry, I was on
I'm,
mute.
I'm one of those pushy broads, you know.
And that's what I love about you.
So I'll just take a motion to approve both minutes.
Don't move.
You have a
Second.
second? Any discussion? What's a minute? Hearing no discussion, all those in favor of approval, say aye and raise your hand.
Aye.
Aye.
Hannah,
Great.
I think that we have to have roll call votes on stuff anymore. I know we had to do that at the county board stuff, that everything has to be like roll call votes because we're meeting remotely.
And we just started that with transit as well. So yeah, I think wouldn't be a bad idea.
All right, Amy, do you want to call the roll for approval of the minutes?
Sure, and I had Judy was the one to motion it, and then Carla was the one to second it, and then Corey Tello, and then Susan Schaefer,
I,
then Hannah Eisner.
Aye. Sorry.
Thanks, Susan, for that update. Okay, so now the first item on the agenda is the RFP process. So I know Amy and Corey, if you wanted to give us some information on what the Mental Health Advisory Board has done, and then Amy on your own. So I'll turn it over to you guys.
And Corey, just to let you know, if you wanted to give an update, please feel free to do so, but I also did make some notes. I didn't know if it would be okay to
Please
share
go ahead. I'll
notes
be-
as a visual. Okay. All right. So as far as the Mental Health Advisory Board that met in July, this was some of the notes. Can you guys see my screen?
It was July 17th.
Thank you, Corey. July 17th. Okay. And don't pay attention to the color coding. Actually, I forgot I did that. That was for my notes. So the first thing that they recommended was, as far as the age and adult services, to put age on, or that their recommendation was the age was too old, which was at 21. And instead of putting an age in there, to just ask the agencies to provide age of clients in the application that would benefit from that service. Do you just want me to go through each one, or do you guys want to provide comments after each comment or each suggestion they made? I don't want to overwhelm you guys and then try to go back.
Amy, can you scroll? Because I'm old and I had to make it bigger.
You want it bigger? I can.
No,
bigger.
I got it bigger. Now I can't see any. I need to scroll down.
Okay.
Here on my end so I could read it.
Amy, I do have a question
Sure.
about the suggestion that the 21 was too old. Did the group have different definitions of adult services, what the age range was? Is that why we're doing that? I mean, is there some, is there a standard, or do they all look at it differently?
I think it just depends on the program, Judy. Corey, you can help me if.
Yeah, I mean, clearly up to the day before the 22nd birthday is the way school educational services, special education for people with
Okay, gotcha.
identified disabilities have to be able to get services from the educational institution up to the day before their 22nd birthday. Clearly, that does not apply across all entities. So what we decided upon, rather than cutting it short for the entities that are supposed to do it up to age almost 22, we would leave it, like Amy said, kind of open-ended, that anybody applying would simply identify the age group they're applying for. It was just so there wasn't overlap between youth and adult, but there is. I mean, no matter how you cut it, there is, because obviously the majority for some things is 18. So there's that 3-year window that is an overlap. And so rather than try to make it finite and limit anything either way, we just said anybody applying just has to be clear on what age range they're covering.
Yeah, and I think what we, in our previous discussion, as we sort of struggled with this, I think what we're trying to say is that there are some programs specifically targeted towards youth. And then there are programs that may serve people that fall into that youth age group, but they're not differentiating youth from the general client population. So I think that will come through in the application. So I'm comfortable with what you guys have come up with.
I think flexibility is important there, and I think the way that it's been recommended is it doesn't eliminate anybody that would benefit in either group. So that makes sense.
Great. The second part of discussion on the RFP for the Mental Health Advisory Board was to allow for some type of language in the contract for renewal of the contract for more than 1 year, if that was something that would be approved by the Board of Health. And so there would be stipulations in the contracts for the renewal. So it wouldn't be an automatic renewal. And so I provided some language to potentially play with, that the initial term would be for a year. And then there would have to be a termination of that contract from either party 30 days within the contract ending. And then if neither party gave any written intention to terminate, then it would be renewed. But however, this would need to be, so if we were in next year and this was the language in certain contracts, and it doesn't have to be in all of the contracts, but if this was language in certain contracts that historically the Board of Health continues to fund, like crisis services continues to fund, and if the Board of Health agrees that they would like to renew that for, say, calendar year 22, then they can have an action item to vote to renew that in calendar year 22. And so then that agency providing that service wouldn't have to go through the application process again. And the board members wouldn't have to spend time reading through that application and grading it.
Amy, would that allow, though, for if everyone is in agreement to the renewal, would it allow for the agency to add in to the renewal any needed changes? If there were some minor changes on something that could still be added into the renewal without having to go through the whole process. Does that make sense? Like if there was some minor change in service delivery or an outcome or something like that, renewal could still go forward without triggering the need to go through the whole process again.
Hannah, what would be your thoughts on that?
I think that this goes to kind of a bigger issue that we have, that, it's not a one-size-fits-all system. And we do have services that we fund rather routinely because we know we need those services, and we have other programs that either we're looking for innovation and whatever. So I guess as you brought it up, I think it's maybe something for further discussion. I think it's an interesting idea, but I think that we want to think about how we do that. whether it's the RFP process or whether there's a mechanism out there to handle this type of funding differently. And I don't know the answer to that. I'm thinking.
Mhm.
Okay.
Because I think if you're saying, I mean, I think there are definitely grants that are handled that way, where it's a multi-year grant. It just gets renewed automatically. And, you know, we've talked about the benefit of not having to go through an RFP process every year for some organizations, but I don't know. I'm not sure yet.
So Hannah, do you think that's something that can be done in time for this year, though? I mean, do you think that can be researched deeply enough to be ready to put that into an RFPs for this year? Because again, we talk about this every single year and we always come to the same wall and stop. And so I feel like at some point we should try to either investigate it and say, yes, it makes sense, or investigate it and say, you know what, we're taking this off the table, because we've had this discussion for at least 5 years now about whether we should do some multi-year. So I just feel like whatever we need to find out, we should find out and make a conclusion. Does that make sense?
Good point. And Judy, you had your hand up.
Yeah, and I think I'm going to follow up on Corey's comments. I find the language a little difficult, and I think if we can all agree on what the intent of this provision is, that there may be people, county legal, that could help us put it into language that would accomplish our intent and not come back to bite us. So I agree that we need to move on it. It sounds like we're all in agreement with providing this opportunity. It's just a matter of how do we state it. And I think we need to do that for 21.
And keep in mind, this language, the RFP does not, you know, I think we may have attached a sample contract, but the contract follows the award. So we have time to work on the specific contract language. I think what we need to determine is whether in the RFP we would indicate that, you know, this could be an application for a multi-year. In other words, somebody could indicate whether they would like to apply for multiple years. Yes, Judy.
No, I think Susan had her hand up.
Okay, Susan. Sorry.
Yeah, I like the concept of putting the idea that this may be renewed. It may be a renewable in the RFP, so that agencies know that. And then back to what Judy just said about having it go through legal to actually, and what you said about putting it in the actual contract on the renewal clause in there from legal on that. But I do think that it should be noted somewhere in the RFP is that, you know, contracts may eventually or may be renewed based on our, you know, whatever. But I think that they should be aware that that's a possibility when it comes to actually working with the contracts, you know, but I know that that's down the road. So the actual language, yes, we have time to do for the contracts, but I do think that it should be somewhere in the RFP.
And Judy, and I agree, because we have talked about that in the past, and I like the use of the word may, because if we put that out there, if we find that we simply can't do it or choose not to, we don't have to. But I think the agencies have talked to us about it, and I know that's what Corey was alluding to, that if we now at least have the idea that this may be an opportunity, I believe that will enhance some credibility out there.
Well, and I think a couple of suggestions. One, I am certainly not one of those, but I think the health department gets multiple grants year to year. And I'm sure that there are things within contracts that address this issue, both in RFP and whatever. I'm trying to think of whether, you know, we obviously renew grants frequently through the Board of Health, the same one over and over again. And I don't know what language was in those original RFPs or requests to apply that indicated that renewals, you know, it's renewable year to year. So I think we shouldn't reinvent the wheel on this. And there's probably contract language in those that could do that. I mean, I would think Camille with her experience, or Tricia, and our own health department staff have encountered this multiple times. So, I mean, I think our part is, yeah, let's find a way to put that into the RFP and to incorporate language. And I'm sure we have oodles of that we can borrow from other contracts. My only question is whether or not, and this is also something I think we've dealt with year to year, is we clearly have some organizations that we just fund. Historically, we've done it, and certainly the psychiatric services is an example of that, and I think our court services is another example where we're basically saying these funds are available to you. So I've never known exactly the right way to go about that, and it seems to me those are a little different animals than saying you have to actually apply every year when we know it's makes them go through the paces certainly to tell us what they're going to do. But yes, ma'am. Cool.
Well, speaking of the court services that we apparently have committed to for the foreseeable future, I mean, the mental health advisory board members did feel pretty strongly that if that is just always going to be awarded, why are we pretending it's that they apply and maybe we will and maybe we won't? Because if maybe we always are going to, it almost doesn't make sense to hang it out there as an RFP. So I agree with you, Hannah. I think there might be I think it's a different animal perhaps, and maybe we should address the elephant in the room and identify it as what it is and not pretend it's like the others. If indeed there is understanding and consensus that it will always be funded.
Well, and I think because the way that is handled is the money is basically transferred to the court services program, and it's a county operated program. I think we could, instead of having the RFP process with the rest of the group, I think we could just have direct communication with the court services folks about what the program is going to entail, et cetera, with that understanding. It's like a budget.
Because it's really not a competitive area, the way we have identified it.
Yeah, Judy?
No, I agree. And I think, Corey, I could probably name a couple of people on the advisory board who feel pretty strongly about this. And I think they're right. It could be, if we separate it out, that we have something like an MOU. There is some kind of a communication of an expectation, but that we don't put it with the RFPs.
Yeah, I mean, I think it could be, we're basically one entity moving money from one source to another, whether we call it an MOU or whether in a budget document where we approve whatever allocation there is for that program. Within that, it is with some documentation from that program as to what the expenses will be that will be covered by those funds.
I would just like to add, the only caveat to that I would see is if and there's going to be such a deficit money-wise at every level in government, but if there would be some sort of continued emphasis on, the criminal justice system. I mean, clearly they're trying to move it to a more, recognize the trauma and the mental health issues and trying to realize that they should be, having a very different approach, and they have for several years. And so they have put money towards those kinds of things. And so I guess the only thing that I would ask us to not lose sight of is if there are opportunities through the years to get grant funding or some other type of funding for that kind of a program, because it's a emphasis from the state or federal, we should not have this in place. This should not deter them from going after those grants. Does that make sense? I'm wanting to, make sure that we don't say, well, because you have this free ticket every year, you don't have to look at any alternate funding or, I want them to still, if there's opportunities, to still look for them. Is that something?
I agree. And I think, again, that could be put in whatever document we prepare that, formalizes the arrangement. Because the county has been able to be successful in behavioral health dollars for other purposes.
Yeah, and I think that that's a good point. And, it may be a matter of asking Mike Donovan or whoever from Court Services to come to a Board of Health meeting to present the program and the use of these dollars, and allow the Board of Health members an opportunity to discuss it with them and indicate what our desires are. So,
But just
Yes,
to do a final beating the dead horse like I like to do, it really does make sense to take it off of this platform, because it makes work for Amy. It makes work for everybody in the court services. It makes work for Chestnut and CYFS and us. And it seems like that we could use all of those energies to help something else.
Mm-hmm.
yeah, so that's a direction we all feel comfortable going, it sounds like.
Yep.
Okay, Amy, do you want to proceed?
Sure.
With,
Yep, and sure, just to clarify on the funding focus areas, take off court services, and then have some type of communication with Michael Donovan that there will be more forthcoming as far as how this would proceed for calendar year 21. Because I just take it off and then him not know what's going on either.
One more question. Do we still want to get quarterly reports though? I mean, that still means we stay in that cycle of quarterly reports and all of that? Okay, good.
So the way that I would view, sorry.
I would not take our 4 areas. I think it remains an area of interest. It's just that we're going to allocate those dollars through a different process.
Okay. So should I communicate to him to still follow through with the application, the RFP application, or to hold off on that? So you guys are saying, not wanting him to do the extra work. And so just a side note, we do currently have an MOU with court services, and it's updated every year. The MOU states that we'll do, there's quarterly site visits, they turn in quarterly reports. Chestnut, CYFS, and CHS, they still provide the monthly financial EDFs, they still do a budget. So we still have all of those accountability pieces in place. Hearing you guys say, like, keeping all those accountability and having that relationship with problem solving courts, but not doing the application.
I for one agree, as long as we spell out in that MOU the fact, what our expectation is of that program category, what will be done, so that it's not just money given for you to choose how it is spent.
Right. Yes, and they currently do that.
Okay, good. Yeah.
And that we still want them to pursue other funding if it becomes available.
Right. Mm-hmm.
Yeah, and I think that could be added to the MOU.
Right. Definitely.
And in terms of whether or not he should prepare something, as I said, in my mind, I think it becomes more of a budget presentation to the Board of Health.
Okay.
The program, what the funds will be used for. That sort of walks us through the MOU, so that there is some process by which we say, yes, under these terms, we're giving the dollars or allocating dollars to court services from our fund.
Okay, so I will reach out to Michael Donovan and let him know that it will be different this year as far as the presentation. It won't be them doing the application, but they can still go ahead and prepare during the RFP process. He can still go ahead and have the agencies prepare their budget and work with them, and then look at during a Board of Health meeting or this subcommittee, then presenting their budget and their program presentation. So then that way the Board of Health is aware of what's going on. Okay.
Is this something we should ask the full board to weigh in on before we make that move? is this something at the next board meeting we should at least apprise the full board before we, pull that trigger?
Yeah, I think Cory, I mean, we could bring it to them as a, I don't know, action item or something. And I don't think we need to take action today. Other than
No, I a question. At our last board meeting, I know we discussed the areas, the focus areas. Did we take a vote? Did we take formal action to approve those focus areas?
Yes.
We did?
Mm-hmm.
Well, then I
Yes.
think we do need to back to the board then. If they've
Well, and I
approved
don't-
the focus. And
And
just
I'm-
let them know that. Okay, well, go ahead.
Yeah, I mean, I don't, as I said, this is still a focus area for the dollars.
I know.
We're just seeing how we distribute the dollars for that particular focus area. So I don't think we need to change the focus area
No,
statement.
No, I'm
I
not
think we do-
suggesting that, but just to clarify for them. Mhm.
But I do think we should take it to the board and say, we believe that the proper way of distributing these dollars is by not an RFP or competitive bid process, but
Right.
them either to us or to the full board.
Mhm. Good.
I'll talk to Jessica about putting that on the agenda. And then maybe and see how she wants to present it. And then, okay, so as far as the contract language, the renewal, it just sounds like maybe in our September meeting, we can have more of a discussion on that to start getting something prepared for the contracts that go out. The contracts will need to be an action item for the November Board of Health meeting. So we do have some time on that. Okay, so you guys have talked about this before too, like during the RFP process, behavioral health program manager schedules a date and time for a live webinar to go through the RFP to discuss the logistics, fundamentals of the RFP bidding process. The information to watch the webinar will be posted in the RFP. And interested agencies can ask questions during the webinar. Look into logistics of recording the webinar and posting it on the health department website. So it can be viewed as needed during the process. And then myself would be the contact person for questions asked by agencies during the process. And those questions and answers would also be posted on the behavioral health website as frequently asked questions and answers. And so everyone can view that, and that would be in the RFP. And so you guys had talked about this, and the Mental Health Advisory Board had also talked about really needing to just have a place to be able to provide just information, like just basically going over the RFP, like step by step, like this is the RFP and what questions they have. It would not be well, will this be funded or can this be funded or, so it would not take it would not take a position of like a board member decision-making. It would just simply be going over the document, especially for new agencies that haven't worked with the Board of Health before, to provide them information. But there's also still some logistics of this that would need to be worked out. But what feedback do you guys have as far as that?
I just wanted to reiterate what Amy just said, and that the people on the Mental Health Advisory Board members felt very strongly that a very that there did need to be a formal meeting for the sole purpose of anyone interested in doing an RFP could get this technical assistance, and that they would know that there was a time and a place for that, and they would be walked through it. They felt very strongly about that.
I think it's a great idea. I think technologically, so I mean, it's more or less what you'd call a pre-bid meeting. So it's just inviting people to attend to get more information about the RFP and the process. And I think that's useful, and would certainly support doing that if we can pull it off, with the current circumstances. And I think it's good when we know people who are interested in applying, which gives us a good idea. I just really want to make sure that we get as wide as we can with notifying people about it. So,
Yeah, I think we really need to, try to find, maybe new and innovative players in this, but I think we also need to be real clear about how much total money is available so that people also don't get a sense that, there's this, we're sitting on this huge pot of money and, they should, they really need to understand that it's a small pie we're dividing up.
And I think we want to be clear, sometimes in these situations, people who, it's required to have attended the pre-bid meeting to submit a proposal. So I don't think we want to limit it, but I just want to phrase it.
I also want to commend Amy because Amy talked about, making sure that there is, after that training, the questions that come up would be in a question and answer document, frequently asked question document that would be posted for everybody to see. And I think that's really important because, like as you're suggesting, Hannah, anybody that couldn't actually attend that direct one, they could still have access to the most critical information, and it would be stated the same way for everybody, applying.
Okay, great. And I'll figure out the logistics on that. We'll go from there. It was suggested during the Mental Health Advisory Board that there's language in the RFP that identifies how the application will be scored. I'm not sure. Was that one of the agenda items? I'm having yeah, we were going to review the scoring process today. So we just went to, sorry, I'm like flashing screens on you guys. So they just suggested having transparency in the RFP as far as how the scoring process will work. Any feedback on that?
Yeah, I don't have any problem with that. I think we need to just decide, and we'll have to work through that process. So, I mean, last time I think we had different sections that we scored using the different criteria, and I think, are they all equivalently? Do they have the same value? So I think it's helpful for people to know that as they apply.
Amy, is the question about accreditation, was that to be a part of the scoring process as to whether or not you had accreditation and by whom?
Sure. And so I did put that in the application where I'm asking them if the agency is accredited and if the program itself is accredited. And so I can definitely on the matrix make that worth a certain amount of points.
Susan?
I guess maybe in here on when you're talking about the program being accredited, and if it is not an accredited program, is it in something like the results first clearinghouse database, and where we can find what evaluations are on that program, if it's like an emergent program or if it's not necessarily an accredited program but highly effective program kind of thing. So if we can ask a question about, is this program in, the results first, database? Because that has all the, a lot of, when it actually has multiple databases that it looks at to find out how those programs are in effectiveness.
Well, and the Mental Health Advisory Board members too felt like we had a lot of discussion around this, but we never even actually, I don't think we actually used the word accreditation, but that's exactly what we were talking about. We were really talking about the need to make sure that staff were, appropriately credentialed and supervised and trained, supervised, evaluated, all of those kinds of things too. We were really looking not only like you're saying, Susan, the effectiveness, is the program evidence-based? Are the tools they're using to deliver the service evidence-based? But also, are the people delivering them, are they appropriately credentialed, supervised, monitored, all of that? So, I think you're right. If we need to kind of look at, accreditation kind of covers all of that. So if they're not accredited, we need to kind of maybe break down what exactly are we looking at if we're not going to stick with accredited agencies.
Mhm.
And Peggy, I see you have your hand up.
Isn't it possible that someone could meet the criteria that Corey was just enumerating and not have gone the accreditation route? I don't think we can universally assume that if you're not accredited, perhaps you're not using best practices and training staff, et cetera. Sometimes accreditation is it's monetary decision.
Right, you're right, Judy. There's a lot of programs that are still using best practice, evidence-based, trauma-informed tools, but it's a very lengthy process to become accredited. And yeah, it's not uncommon for effective programs to not be accredited. So I think like the having follow-up questions is goes
Yeah.
along with that.
Very good. Thank you. That's a good idea.
Yeah, it's really just about, are there certain standards that have been, obviously, if they've been accredited, you know that the boxes have been checked and they have documentation that all of those things have been met. And so that would be the difference. I don't know that we would have the same level of documentation that they've checked all those boxes. So I don't know how we gather that without, I think it can be done. I just think we have to be more careful about a non-accredited agency. And
I think there's a huge difference between the agency being accredited and the program being accredited. And so in my thoughts, and maybe it's definitely appropriate to ask if the agency has any type of accreditations. But as far as like the program being accredited, we may not want to necessarily ask that and really just focus on asking them, what are your evidence-based practices, your best practices? Are you going to incorporate trauma-informed care, equity? Really focusing on that, because the other thing to remember is if a program is accredited, then that has very specific parameters on it and very specific specifications on it that may actually not be what the Board of Health is looking for. And so, for example, if we say we want it to be inclusive of this age group, well, according to my accreditor of this program, I can't include that age in this group. And so we have to really be careful of what we're asking for, because there's a lot of limitations that from the federal or state government, if a program is credited, there's a lot of limitations that can be put on that program that may be contradictory of what the Board of Health is wanting to support.
Judy, did you have a comment? Judy, no? Okay.
No.
Susan.
Yeah, I guess, mine was more on the wanting to make sure that there's specific tool that they're using for whatever it is evidence-based and making sure it's very specific. And I know some of the applications in the past have said that, and whether they're accredited or not, they're very specific in what tools or methodologies that they're using. And I guess that's where I was coming from on that database to be able to check on that as to the effectiveness on that. So I think I want to make sure that they're very specific in what they're using, not necessarily whether they're accredited or that program, like we were talking about with the specifics. It's like, was it Healthy Start or something like that as an accredited program? And so it takes a lot more than if you did the same kinds of things, and there might be other evidence-based practices that are very similar, kind of thing that wouldn't be necessarily accredited. So that's where I'm coming from on that.
So it sounds like what we're talking about is we'd like at least an indication if they are accredited either program-wise or agency-wise in the RFP, but we would not necessarily use that to eliminate anybody from consideration. And I guess the question then would be, do we want to even give some weight to an accreditation or not? I mean, I tend to lean towards it's worth something, but sometimes accredited programs don't perform as well as unaccredited programs. You can get used to doing what you do. We're looking for creativity and flexibility too. So I think we should ask. I don't know what weight we give to the answer.
I just want to make sure that and that the mental health advisory board members weighed on this too. And that is, again, we want to make sure though we have highly qualified staff. You know, we want to make sure that, because what's happening right now is because there's such a shortage of master's level people, you know, sometimes they're getting people that, you know, haven't maybe gotten, you know, again, they need maybe more supervision, or they may be new to this particular practice or this particular age group or whatever. And so I just want to make sure we're also paying attention to the certification and the quality of the staff that are delivering it, because an evidence-based program, no matter how good it is, if it's not being delivered by somebody that's, you know, really paying attention to the integrity, then it doesn't help us. The tool is only as good as the person using the tool.
Quick question, Hannah, and this is more to Amy. Amy, I thought in previous contracts, or maybe RFP, I forget which one, we've asked for the credentials of the staff providing the services we're funding. Have we not? I thought we had. Mhm.
I'm not sure if we specifically ask for the credentials, but we put in there that they have to be at credentialed at a level to provide that service per like state or federal requirements or license requirements. But Judy, that's a really good point to put, like, please put what qualifications, or what, I can't remember what word you just used now, but what qualifications will your staff have? Will they be at a bachelor's level, master's level? That's a good point, because some of them too, we have to remember, like, it kind of gets into that gray area where we want highly trained staff providing those services. But then the other thing too is we want it to be cost effective. And so someone at a bachelor's degree level or even lower, or based on their credentials, can provide the same service that's more cost effective than someone that's at a higher level. Maybe that person at a higher level can provide different services that person at a bachelor's level can't provide. So I will ask to include what staff's losing thought on the correct wording on what their credentialing levels will be.
And while I hate to use the state and the feds as an example, we might look at the language that they use in funding programs. That might be helpful if there's something out there that seems to be similar to what we're looking for.
Okay.
I
Well,
agree with
even,
that.
you know, we also are talking about peer, you know, in some cases we're talking about peer lived experience workers. And so again, even that, some, you know, that can be certified or not certified. But again, we just want to know, if they're not certified, what level of supervision are they getting, or all of that stuff too. So it isn't always credentialing. Sometimes it's also the supervisory piece, depending on where they fall on that continuum of training.
Two thoughts I have here. One is, you know, I think our intent this year was to be less specific in our RFP to invite creativity, and, you know, and it sounds like we're kind of getting into, I mean, I'm not questioning the need to make sure we have the right people with the right training doing these services, but I think we can, when we get the applications, then we'll see. And I certainly think questions that ask what percentage of your staff are master's level, whatever the appropriate training level would be, I think we want to invite them to respond in the application, and we'll see.
Mm-hmm.
And I think some of this, what I'd say is, Amy, I know you're probably still working on the RFP. At some point, you know, I don't know when you think you'll have it ready, but I think if you can distribute it to us, and we can respond back with some of these areas in mind as we look at what you've drafted. There are going to be many ways to put it out there. And, you know, I think what I'm hearing is that we want something that addresses the accreditation and or also the staff education, training, and et cetera.
Yep, sure. And I have the RFP draft ready up to the point of this meeting. So I will just have to make the edits and additions off this meeting. So I should be able to get that to you guys, and the application just needs formatted. But I can get you the drafts of those today, hopefully at the latest. So then that way, because it goes out next Monday, so then that way it can be a quick turnaround for your guys' feedback. But that shouldn't be an issue to get it to you guys. The
Yeah, I would like us to have a chance to do it before it goes out.
Sure. Yep, I
So-
got it in my notes. I will definitely do that. Then
And,
they-
and Amy, Tricia will also see this, right? Tricia Malat. I feel like it might be helpful for Tricia to take a look at that particular part, the credentialing and the, kinds of things, because she's obviously been in a position where she's been an office manager of clinical people. And, I think she's got some experience in, knowing what to look for too. Does that make sense?
So you're asking for Tricia to also review the RFP and the application
Yeah,
So
what do y'all think about that?
and to Tricia?
Yes, thank you.
I
Okay.
mean, I guess my thought is a couple things we talked about in terms of like the renewal language. I mean, anybody who's got some expertise and can give us some guidance on that. I mean, as I said, I don't really want to recreate something on our own that when there's good language out there that's been tested. Yeah. So,
Yeah, and you guys brought up a good point too, as far as the renewal language. As far as like contracts within the health department that we are awarded, I'll work with finance to see different examples of how it's worded in their contracts.
I
And
mean,
we,
I just had a thought on that renewal piece. The one thing that does to us, of course, is it potentially commits dollars in future years. It's a May, but if somebody, I think we have to think about budget-wise too, how we do that. And I'm just thinking this through now, but usually renewals sort of become read of like, okay, if I don't screw it up, then, I can count on getting this money again. And I think we have to assume that if we put that in there, that we're making that kind of offer to people. So I think we may want to, I know, Corey, I agree with you. We've struggled with this, and I almost think, rather than dance around it, just say some things are, we know it's a valuable program, and do we make them multi-year? And I know we need some legal feedback on that. Everything is always cushioned on the availability of funds, but if we have programs that we say, well, we're going to renew, then we're going to be in a situation, I think that's what renewal does, is kind of awarding this to the same organizations year to year. And I have to turn off my camera for a minute, but I'm still here.
Okay, so as far as their other feedback, defining specialized therapy in the focus area or case managers, I think that kind of goes back into that will be in the application under a project description for them really to focus on. If they're looking at funding for case managers, then for them to really identify what that case manager would look like and their purpose in the program. So that would be addressed in the application. And then this was eligibility requirements for funding. And I think a lot of this we've already talked about, and you guys have really hit home, making sure evidence-based assessment and tools for treatment and interventions is being provided. And if it's not evidence-based, at least in the process of being evidence-based, because that can take time and money for something to become evidence-based. Clinicians are qualified to provide identified services in the program. Agency has experience in providing identified services and program. Following focus area parameters in the direction of program proposing. Provide trauma-informed care approaches to staff and participants. Provide health equity practices. Provide inclusion practices, including racial demographics of the service area, and inclusion plans to promote program service statistics are closely representative of geographical demographics. Provide cultural humility practices. Agent has the necessary facility infrastructure, including space, telephone resources, technology resources, et cetera, to support the proposed program. Agency has enough qualified staff to provide program at the beginning of the contract period, January 1st. Agency has a qualified supervisor to oversee program infrastructure and functions, and staff would be implied in that. Provide information on which zip codes and or geographical services will be provided. So that was their input as far as making sure with the eligibility requirements. The only
Should-
one, sorry.
Should that say, I'm wondering if that should say racial, ethnic, the one about include racial, ethnic demographics? I'm not sure. I'm just trying to, that strikes me oddly when I read that. Anybody else? I mean, I just think racial, ethnic, and do we want even gender?
Gender.
Yeah, gender, I think we want to.
I think we also need to put something in there that they need to identify what they are doing to promote, to get the people who are racially, ethnic, and gender discriminate, people are discriminated against, how they are going about attracting those underserved populations to their program.
And I put that in the application on give tangibles on how you're promoting and inviting people of, and I did
Okay.
put regarding gender, race, and age, I believe. The only thing I can include ethnic, but ethnic is usually very vague, where it's just like Hispanic or non-Hispanic. And so to me, it was really about race, but
the way it's
We also
stated
want-
now, it would just imply racial. And when I think of, areas of disparities and inequality, it's much more than race. It is the age, it is the gender, and it is other people of color.
I wonder if we need sexual orientation too, because clearly LGBT, they're the ones that have really been, I mean, we've got some huge, that group is suffering greatly under this pandemic and some of the discrimination that's been directed towards them.
I'd like to use the word gender identity versus sexual orientation.
Yes, that's much better. Thank you, Susan. And I just wanted to tell you all that cultural humility, that was a new one for me. We
Yep.
called it cultural competence, and that's actually what's on our strategic plan that runs along the bottom of the strategic plan that, we're going to become, making sure we're culturally competent. But what cultural humility means is it kind of takes it up a level, and it's saying that we're not just getting culturally competent, because culturally competent implies an arrogance that, like, okay, we've read a few things or we think we know, we've learned about how people with different, socioeconomic backgrounds, how they approach life or from different, but so now we're like these experts, and what they're saying is, no, you have to approach this with the humility that comes from knowing that you will never fully understand the experience of someone who is of a different race or of a different gender identity. You'll never fully understand it. So your job is to listen, learn, and approach that much differently than just thinking, well, I read some stuff, so now I know.
Thank you. I was going to ask about that. That's very interesting.
And just real quickly to back up, there would be, gender identity, but that wouldn't necessarily cover the sexual orientation. But I think instead of using sexual orientation, using the LGBTQ plus to appropriately cover that area to make sure we're inviting of that. And that could be even different than gender identity, but also gender identity too.
Yes, it is.
Well, and I'm going to chime in here. I think all this stuff is great. But I have to ask, how are we going to use this information? I think, now we got applications that we're scoring. I'm just a little, I believe that we should be telling everybody we want. I don't know exactly how we do this. I mean, I think we're getting way, way, way deep into, something. We ask them to provide all that information, and then we make a decision on an application. And does that provide ground for somebody to say, oh, well, X, Y, or Z? I mean, are we going to actually evaluate these applications on those answers?
I think
I mean,
we
I think
should.
we have what we put in there and make sure that we're going to use it in some way and not just have a lot of information we're asking for that people will certainly say yes, 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 yes on, yes, we're a welcoming organization. Yes, we, you know.
Can I just,
And we have specified that we have programs that we are focusing on serving a particular population at this point, except for people with mental health issues.
can I just clarify real quick that they, in the application, there would be a plan, like this is how we plan on providing trauma-informed care approaches, ABC, or this is how this is our racial demographics of this area. So for example, like a rural school may be predominantly white by a very high percentage. And so making sure some of those service statistics, even if it is predominantly white, that would still be representative of that area. So there would be plan, but going back, like they would identify plans, and then those plans can move forward into their contract language. And then that contract language can move forward into me monitoring it during site visits. So you said that this was part of your plan, and it doesn't mean that they're going to be able to have their service statistics at the same level of racial demographics in their area or gender demographics in their area. But then I would still be monitoring it. Are you trying, what are you doing that you said in your plan to be inviting and to be inclusive? So it wouldn't, I understand what you're saying, Hannah, but no, it's not just to have a question in there on like, are you doing this? Yes, I'm doing it. And then we just leave it alone. Like there would be follow through even on my end.
Judy?
Given the scrutiny that we're under, I really think this needs to be something that shows up in the grading criteria and the scoring criteria.
And if I could, to follow up, Carla, I think that these points here are really speak to health inequity and disparities. And I believe you're going to see all of our programs at the health department begin to match ourselves and evaluate ourselves on these very points. So as an extension of what we do in the way of services, we provide funding for these. So I think that this kind of criteria will be looked at as we try to demonstrate that in everything we do, we recognize disparities and inequalities.
I would hope that everybody, like as we are doing as an entity, reviewing our policies and policies, procedures, practices, looking through these lenses. And I would hope that anybody delivering behavioral health in McLean County would be doing that same thing, looking through the lenses of these as they're thinking about their policies and procedures. And I think this is just a way of us making sure that message has clearly been sent, that this is the way we do business now. And everybody in the behavioral health realm in McLean County should be doing business with those factors thoughtfully addressed.
No, I think we lead by example.
Yeah, and my question was more to just being clear that when we're asking for this, that we intend to score it and use it so that, people applying are well aware of that.
And I think your point, Hannah, is a great one, because I think in our minds, which we're going to be doing, I think with our own health department staff, we have to be crystal clear on what is it we're looking for when we say, show us that you're doing these things. So you're right. We've got to turn this into concrete checkpoints, action steps, because it's really, like you're saying, it's really easy to say, oh yeah, we're a very inclusive agency. Well, we have to be able to say what are 2 or 3 concrete visible indicators that you are doing that shows us that. So we've got to, before the RFP goes out, we probably do need to think a little bit about how they're, and Amy, as you think about when you do your site visits, what are the questions you ask to get at those things? And maybe that's what we're talking about. What are the specific, because we do have to be specific.
Okay, so move on. Is that, I think at this point, it sounds like, what we'd really like is to see the draft RFP, and I assume these are in there already, since they came from the Mental Health Advisory Board. And I'd say everybody, once we get a quick turnaround so that, just submit comments back to Amy, I think. And then if you can then send us what would be a final, maybe, then, we can go from there.
Yep, I'll send you the draft after I include today's comments and feedback. I'll send you the draft of the RFP and the application. And then we'll go from there. Get your feedback.
Okay. So any other discussion on the RFP process? I mean, I just want to, one thing that I wanted to just emphasize is, I know we post this on certain websites, et cetera, but just, to get it distributed as widely as possible, it's obviously a goal we have. So I don't know if there are possibly places we can send it to that we haven't before. Just try to get as many people interested in applying as possible, which maybe makes our job harder, but.
And I did share it I shared the link on the pathogram, put it in the pantograph. Of course, it's on our website. The only other thing I can think of is maybe sending it to nonprofits, but then there's a chance that, we're not going to be able to know of every behavioral health nonprofit that exists in McLean County. But if you would like for me to distribute some, I can.
Do we do a pantograph story? Just call Paul Swiken and say, would you do a story on it?
I can talk to Jessica about doing, what is that called, a press release, about doing a press release?
Well, weren't we talking maybe more about a feature story than just doing a press release?
Okay.
Is that what you're meaning, Hannah, is to kind of maybe get Paul Swike involved and kind of taking a look at our focus areas and what they mean as a way to do a feature story rather than just a press release?
Yeah, I think anything that would reach a few more people probably.
Okay. I'll definitely talk to
and,
Jessica about that.
Okay, so anybody have anything else on the RFP that they wanted to bring up? Yeah, Corey?
Susan, you and I talked yesterday, and you had mentioned, that we want to kind of really frame adult services, that maybe we want to be a little more clear in the RFP about what we're hoping to make available to citizens. Did you want to say anything about that? Because I've been thinking about that a lot.
Yeah, one of the things that Corey and I talked about was, we talk about psychiatry, services and stuff like that, but we know that there's a growing concern for just some counseling, just general counseling, only maybe needing 1 or 2 appointments, especially because of COVID and the stresses that are being put on a lot of people, that, you talk about parents that, don't know whether to send their kids to school and that kind of thing. Not necessarily that they don't have a job, it's just how are they going to work at home and do they're just kind of stressed. And as our cases have gone up too, we don't know there's so much uncertainty for the next, who knows how long. And when we talk about adult in our focus area, I don't necessarily believe that we should just focus on psychiatric too, and that I would like to see agencies come forward that offer just counseling. And I can give you an example of someone I know that was going through a lot of stresses and realized that they needed to talk to someone. And so they found someone to talk to and made 1 appointment, and then has a follow-up appointment, is not sure they're even going to keep it because of what they got out of that first appointment. And it's just counseling. It's not psychiatric. They don't need meds or anything like that. And so I don't know how that is going to be described in that, because I think that the demand is going to skyrocket. And it already is increasing. Even Megan Mosier has said that there's more increases in crisis calls, but some of those can probably be addressed in other ways. And if there's something out there to increase the capacity of some counseling in the community, that's what we're doing, is we want to increase capacity. So I don't know how that fits in with our adult part and how well we've described that kind of potential funding issue.
Susan, I have a question. Is this I mean, what you're talking about sounds what I would describe as an EAP type thing, which is usually, employee assistance programs, which employers have made available, contracting with counselors. And I don't know whether this individual was employed and had access to that kind of service, but that's the idea of very few sessions just to help get through something, and referral for long term if you need it. But yeah, I mean, I think we talked about that before about, this isn't just, again, I think we have what we call the proverbial elephant in the room with this. We have contributed a large portion of our money towards psych services into the crisis program, which leaves, I don't know how much left over for other kinds of programming. So yeah, let's hopefully we can write the RFP to encourage people to apply, to give us some idea of what's out there, I guess, at this point. Or whether we need to serious, the right people together to evaluate, how do we really effectively use dollars? Is it about it? It's we ask these lots of questions. Yeah, Judy.
Yeah, no, as I'm listening to you, Hannah, I'm really reminded that when we looked at adult services, we were talking more about the long term. We were talking about, psychiatric follow-up. We did add counseling, but as you look at the description, at least one I have before me, talks about the long-term mental health needs, and the psychiatric follow-up, that's really separate from what we're talking about now, and that is that immediate access to counseling short-term for people that are really struggling emotionally as a result of COVID. And we have two very specific areas, I think, within adult services. And I don't know if we prioritize one over the other, or we acknowledge that we're going to look somewhere else for money for one or the other. But in my mind, we have two kind of pretty separate things there.
Yeah, the key, what you just said, and I didn't say it, and I know we talked about it when I talked with Corey, is the term short term versus, and that's where I said it's very different than adult psychiatric that needs medication management and things like that. The severely mentally ill, the 8s, 9s, and 10s or whatever. This is the 2s, 3s, and 4s or whatever, somewhere in the middle, the 5s in there that just needs some short-term counseling, and that's what I'm talking about.
Yeah, and in fact, we just see on the screen here, immediate counseling services for short-term needs, and that maybe, as we're talking, should not be the last phrase in the paragraph. But again, I say that we've got two different programs, I think, here under adult, but we have to be mindful. I'm not sure how we resolve it, but we have to be mindful of the long term and the people who need psychotropic medicine and follow up on meds, and those that are just struggling right now, then in 3 years may feel a whole lot better, but right now needs some counseling support.
And in fact, our dollars may be better spent on those folks who then avoid the long-term problems, possibly. I also think this could fall under crisis, because I think we did talk about, I think we added short-term counseling to that section, if I remember. I don't have it in front of me. Because I think, I heard an anecdote the other day about, I guess, this crisis services, they had at one time referred people into counseling after the crisis abated. It also got them into counseling, which is not necessarily happening right now, as I understand.
And again, I guess from my perspective, crisis response, I think is what we're calling it. that's a whole area of service. That's a whole program. And then they refer to referring people to include counseling as well as crisis response. That suggests a much bigger amount of money that needs to be available.
I just,
I don't know how to resolve this, folks.
well, let me add just a little bit. So I think we got like 3 groups, actually. I think we got the group that is the very acute crisis, it's more urgent, it's acute. They're going to need services
Right.
to get them settled down, but then they're going to need ongoing services because they have deeper seated psychological problems. So they may truly have personality disorders. I mean, identified, mental health. They have a category of mental health illness. That's one group. Then we have the group that we've just been talking about, which is the ones that are, because of this pandemic situation and their life being thrown asunder and having anxiety related to maybe economic problems they've never had, work situations they've never had, worried about losing their insurance, all of those economic issues and/or just fearfulness in general. And they need some immediate guidance and support, but it could be short term because maybe they just need support and direction. And then you've got your group of people that actually that group that has had everything pulled out from under them is almost its own group because they're going to need a different kind. They're going to need almost like case management because they're going to have to be directed to resources until they get back on their feet. And they're also going to be underinsured. And then you've got the group we were talking about, which is the ones that they still have kind of a stable life force around them, but they're very fearful because the world is so weird now. And they might need, almost like Hannah was talking about, like an EAP response, just a couple of sessions to just kind of help them sort through it. And so I feel like we've got those 3 different distinct groups. And we've already got programming for the first group, which is more crisis and long-term. And then we've got, but this new group that is coming to Mid-Central Community Action and saying, for the first time in my life, I need help with rent. I need help with utilities. I don't have insurance. I don't, all of that. That needs a case management kind of approach with some counseling. And then there's the short term, that can we have some agency or agencies come up with something really creative to address that EAP need for people that may not have it offered through their employers? Or do we also need to do a fabulous marketing on, do you know about your EAP? Are you using your EAP?
And do you know to call 211 who maybe can direct you to an EAP?
Right.
Because I think I'm thinking about the amount of dollars that we have, and I don't think that we want to spread them so thin that we end up just kind of putting a Band-Aid on a few things.
And I will tell you that in the month of June, they had 198 calls just for what they call support only. And so that was people calling to say, I'm pretty freaked out. I'm very anxious. I need some, I just need to talk. I just need somebody to kind of talk me through this. And that was a 38% increase from the month before, 38%.
I guess from my perspective, that kind of speaks to the point that maybe as part of what we do in behavioral health, not through this funding process, but as part of it, we really work and collaborate with places like PATH to identify options for people, because we can't provide all those options, but maybe there are groups we can start collaborating with right now and put together a program that reaches out to our community, that allows people to know that they have options. And I know they're very limited, but if we try to define crisis response to all the areas that I think we've now recognized need it, we're not going to be able to do anything very well.
Well, those would be under adult services, Judy. Some of the stuff I was talking about would be under adult. services.
Mhm, I know.
not-
Mhm. But even
Well,
at that,
let me-
we still have very limited resources.
And let me jump in here if I may. One, I'm going to be kind of the whatever. We developed those statements, and I don't object. I think it's a good idea if we think that the adult in that statement of priority area or concern had, it was including but not limited to. So in the RFP, we want to make sure that there's more language about counseling. So, I think we should do that. I mean, we deliberately did not get really specific about this because we were, and the mental health advisory board was in essence saying, let's make it broad enough so we can invite the community to be creative and give us a good response. So I think, yeah, I agree with you, Judy. I mean, we have only so much money. There's so much need out there, Corey. We go crazy trying to think we can address it all, but we have
Well,
not.
that's why I'm making the point that maybe part of our role isn't just giving money. Maybe part of our role is like bringing, as Judy said, bringing some people together and saying, what are possible providers that aren't going to apply for our money, but possible providers that we need to have them, be front and center in people's minds so that people do know, if I'm feeling this, I could go here, and how to do that. And I mean, just make it that whole marketing thing. And that takes us back to that function that we've got, that $25,000 sitting there for. This might be the perfect time to do that.
Yeah, I think you're right. And we are more than just a pot of money. We are a program. So, and the marketing thing, I think once we get through this, I think that's a great idea to come back to. So, so I think, Amy, if you've heard this, I think, looking at that RFP for the adult services to make sure that it does include language that it lets people know it's not just psychiatric long-term, but could also be programs that involve a shorter term, non-crisis, but still short-term counseling.
Mhm.
Are we interested in adding, I think we have case management in there. I think we made that broad enough that, because some of the things I'm hearing from agencies is that as they've tried to analyze what these new needs, what would be the best way to approach them, and some of them are through more case management than more traditional counseling. It's more, they need somebody that literally can kind of hold their hand until they get transitioned to some resources and some, solutions to their problems. So I would love it if somebody wanted to go after a case management function in their RFP. But I also think we need to be really clear how, are we believing that our money should be used, if again, because we can't cover everybody, is our money to be used for the people that are the most vulnerable, the most unable to get services anywhere else? And so again, does our RFP need to reflect that, so we don't make it sound like, oh, we want to try all these new really cool things, and but yet we really are never going to fund them because we really can't, because our primary responsibility is meeting the needs of the most vulnerable citizens. And I'm asking, not telling. I'm very interested in your thoughts on that.
And Corey, I think that's a really good point. I guess that's what I was hoping to express. We're mandated by the state, through providing mental health, just to provide these services. It's my understanding that providing to the least able to agencies able to get funding, the dollar of last resort, that has been our position at the health department for many years. And if we don't reflect that somehow in our language, then we may get people that have some very wonderful creative ideas, but there will have been a lot of energy maybe expended to prepare that, and we aren't even able to begin to address it. Or are we talking about changing that? We're looking for those creative responses to the immediate need, and the dollar of last resort is perhaps no longer the focus. And I'm not suggesting that we do that, but it's something I think to consider.
I do think we need to give Amy direction, though, because I think if we because we've and I mean, myself included, we've kind of been all over the place here. So, you know, do we want to use some dollars to meet needs of people who have milder issues? I mean, they're milder in the relatively speaking, but could get a faster response by shorter term counseling, and they could kind of be on their way, you know. Or again, are we saying those are dollars that would take away from people who are in more dire need, and who are closer to, you know, really, you know, losing a home, breaking up a family, possibly going into deep depression, suicide. Again, I think we need to give Amy direction on kind of framing it, because while I want to hear what wonderful ideas people have, and I think we should be figuring out how to try to get them funding, even if it's not us, I don't think we should mislead everybody to think, you know, we can fund everything.
And if I might add, Corey, if I look at the description under crisis response, it does mention, among others, short-term counseling for de-escalation of symptoms. And that's sort of what we're talking about here. So I guess it's in there if someone wanted to apply it to the current situation.
But again, Judy, I'm looking more at the adult services, not crisis. I think the adult is what we're trying to define in terms of counseling.
Okay, and if I may, let me suggest something here. I know my battery's dying and we haven't even talked about the scoring process yet. These are important discussions. My thought is we do have a behavioral health coordinating council that is supposed to be a body that would sort of bring these issues to the fore and decide, you know, how we address them in our community. So I think we need to push that group, and then maybe it needs to get a little kick in the rear end a little bit to get activated again. I understand it's been kind of not as active as others, because we certainly can't solve all these problems with our dollars. I think we've already kind of made the decision to make the RFPs broader to see if we can invite people to come up with things. And we've said we like the idea of collaboration. So a case management model could involve a McLean County Mid-Central Community Action pairing with somebody else to provide the counseling piece to people who they're helping with otherwise. I mean, we don't know what we're going to get yet. And I think rather than try to anticipate all that in advance, I think we need to let this thing go. We're kind of at a point where we've got to get it out there so we can get the apps in. And it's not perfect.
I agree, Hannah. I think that the BHCC probably needs a more specific charge. And if we do that, they need to be given the context into which we're asking them to help us evaluate or look at this for recommendations, because I don't believe that many of them would have the kind of context and information that we've got before us this morning.
And it'd be a great thing for them to take on, you know, at this point in time.
I'm on BHCC, so I can kind of work on that part of it, working with Chairman McIntyre and Tricia to work towards that kind of thing. We did not have a meeting in June, and we will probably be meeting in September. So we've got time to talk. I've got time to talk to them and pursue some of this too.
And what are we asking them to do? What do we want? What are our expectations of what we want from the BHCC?
Judy, can I make a suggestion? Is that take that up today? I think that's a great idea for us to come back to them with that suggestion. Be comfortable putting that into a September meeting of this committee. Right. And really.
We're not talking about abdicating our responsibility or anything along that line. I think we need to craft what it is we expect from them, or we may get like we're kind of all over the waterfront with a lot of good stuff, but we're not able to focus right now.
So if that's okay with
we'll come back to that. Is that what you're saying?
Yes, I am.
Okay.
I do want, if this makes sense now, and we may add that to our September meeting, but I still am very interested in figuring out the marketing piece, because I think it all relates. You know, how do we let people know what is out there? But we also have to make sure that what we're marketing has some good fits for different groups. And so again, that's what I'm hoping BHCC looks at, or what are the different services that can be more individualized for the unique groups that we're trying to reach, and that have tended to be low utilizers. But I do have a whole list. The Mental Health Advisory Board came up with some really great marketing ideas about where to locate information about accessing services, and would love to share that at some point. So I don't know if this is the time to do that, or that would be part of that September meeting, or whatever. Or
I think I'd like to suggest that we devote our September meeting to that. That'll be kind of a break. I think we will have the RFPs out. We won't have the applications back into review.
Mhm.
So it'll be a good time for us to do that. If
I
that's
like
okay.
that.
Yeah,
Very
so
good.
in that time, before we have to go through the application review process. So that said, I think the other item on the agenda was to look at scoring, or how we want to do it. I think mechanics is part of it. Do we as a committee anticipate being the panel that would review all applications, as opposed to them being sent to the full Board of Health? I think we had at one point said maybe it made more sense to keep it in a smaller group. And within our group, do we want to divide it up by, we don't know how many applications we're going to get, so.
Can I also just quickly share what was in the calendar year 21 funding guidelines as far as the selection process? So then that way, if it needs edited, then it's easier to just edit that document than starting completely fresh. Okay, here it is. So I just pulled the section on this. Can you guys see my screen? No, I gotta share it. So this was in the, what is currently in the calendar year 21 funding guidelines document is that in September, the request for proposals package will be turned in by the applicants. The Behavioral Health Policy and Funding Commitment and MHAB will receive the proposals to review utilizing grading matrix. So during the time that we originally discussed this, it was decided on for everyone in all the members in those two boards to receive all of the applications. So then that way, if there was other input needed, there wasn't the challenge of last year of some members not seeing certain applications. And then after that, the Mental Health Advisory Board would meet to provide advisement for funding to the Behavioral Health Policy and Funding Committee. So that would be what they've historically done, was meet and discuss, and then they would provide advisement to the Board of Health. But for this year, since we have the subcommittee, provide the advisement to the BH Policy and Funding Committee. And then in October would be the approval of funding allocation by the Behavioral Health Policy and Funding Committee to meet to provide advisement for funding to the Board of Health. And then the Board of Health would approve funding allocation for 2021. So that I just thought it might be helpful to share what we talked about that was in the calendar year 21 funding guidelines. And then like, if you guys want edits or whatever to that process.
Susan wants
And
to.
so, Amy, with this explanation, we are all going to see all the applications. And I thought that's what we had discussed.
That's correct, Judy. And
Yeah.
that was because of the challenge of last year where there was a disconnect between some seeing some things and some not, but then being asked to vote or take participation on something they hadn't seen the full application of.
I then thought that because this committee was created, that the Mental Health Advisory Board advised us on the areas for focus on funding and things like that, that they weren't necessarily going to be part of then the evaluation, that it was to fall to this group. Maybe I missed something. I can't remember, but I kind of thought that there was a different delineation going on too in some of those conversations. And they happened far enough ago that I don't remember everything. Like, it feels like it was 3 years ago, even though it was only 6 months ago. So I guess that's kind of where I'm at, kind of confused on that, on everybody doing the grading matrix. And then it's almost like an extra step that maybe not necessary, because if us as a committee and the mental health advisory board as a committee reviews that or grades that, and then they're going to give us advisement, and then we're going to then figure out what we want to advise. I guess that's, to me, kind of confusing.
So what is your position, Susan? You feel that at this point, this committee should take that on and not have the additional layer of the mental health advisory board?
Kind of, because I think that since we are the ones, recommending to the Board of Health, they recommended a lot of things to us. We also know what their positions is on a lot of things by the information that we've gotten from them and with our joint meeting, as to what they think some focus should be. I mean, I can go either way on this. I just was kind of questioning, do we have to make that extra step in there? Because they could, whatever.
No, I tend to agree with you, and I think we did talk about that, but I'm interested to know what the rest of the folks think. So Corey? You're on
Thank
mute.
You got a hand up first, so I'll do Judy and then me.
Okay. Judy?
Your mic's off, girl.
Yep, there you go. And I'm sure you don't want to miss a word of this. But I think I tend to agree with Hannah that, I could be persuaded either way. However, I'm also curious as to what, at least for this next round, the 2021 funding, what is the expectation of the advisory board? Because I'm reminded that, we've kind of gotten over a hump where they were not feeling like they were being used in any kind of advisory capacity. And now we've given them a stronger role. Corey, is there expectation this year that they will see all of the applications for next year?
Amy might be better able to answer that than me. I'm not sure they have any expectation right now, other than they're going to have input somehow. My concern is I think there may be a couple of them that might actually be applying for some funds. Would you agree, Amy? And so their entities that they represent might be applying. So that creates a problem too. I'm trying to figure out how we involve them very meaningfully. And yet, I almost feel like if everyone on the mental health advisory board gets to grade, and only those of us only a small number of the Board of Health members get to grade, it seems a little imbalanced. And so I'm trying to figure out, but I also have this real sense that, as we've had these discussions, like this very rich discussion we've had today, so we come to that now with all of this context in our brain, and we have the same context. So we're going to kind of be looking at it through that context. If they haven't been part of all those discussions, then I feel like there's going to be kind of a splintered approach to it, which is what we had last year. And that was disastrous, I thought, because
we missed.
People just had a little bit of information and some had a lot. And so then they didn't think through all the big features and factors that we had talked about. So I want to avoid that. So the only way I could see is it possible that a couple mental health advisory board members could be representative and grade, And how would we choose a couple? I mean, how do we choose this group? That kind of thing.
Yeah. And if I might, Corey, how would we make that choice? And I'm not as maybe focused or concerned about the numbers at this point, as much as they are advising us, and it will mean more work for us, obviously, if they hand in recommendations or thoughts. Maybe we should define what we mean by advisement. But anyway, if they're giving us advisement on all of our potential applicants, and then we have more information which to go through. But I think that to try to identify some members who would want to do that from advisory, I believe might tend to maybe not be a good idea at this time, because as Corey knows, that and a great effort's been made by Amy and Corey to really pull this group together as people who are in the trenches on the ground, and we've said we want you to advise us. So I don't think we want to jeopardize the fact that we're bringing them along with that notion.
Well, and a thought I have too is that if they are, I wasn't aware that some of them might be applying, which that's a different topic, but the applications provide financial information and others, and I think that should be maintained within the county's, the Board of Health's purview. And I guess I feel more strongly now than we've had this discussion that the application should not be distributed to the Mental Health Advisory Board members, and that we should do all the review. I think they've given us wonderful input in terms of priorities and the RFP and whatever, but these are folks who are in businesses that may benefit from seeing proposals from their competitors, and that, applications and bids are usually exempt from FOIA for that reason. And so I guess the more I'm thinking about it, I think it would be inappropriate for them to have them.
So is your suggestion that we narrow it completely down? I mean, we come up with what we're going to recommend, and then we run that first by the Mental Health Advisory Board and get feedback. And then the final stop would be the Board of Health to review and approve. Is that what we do? But we're the ones that make the recommendations. But then if we take it to the Mental Health Advisory Board and they say we have a problem with X or Y, then what do we do with that information?
Well, I think it puts us in a very awkward position to let them who are practicing in the field and in business, to be then passing on who we fund. We've
That's
asked
what
them.
I'm asking. How do we not involve them, since their whole purpose is to advise us before
That's a great deal of information and input up to the RFP even. And I think that we have to maintain a certain line at some points. And I'm sorry to say that, but that's what I feel. So Susan, I know you had your hand up.
Yeah, I kind of, the more I think about it, the more I think it should be us. And yes, they have, like Hannah said, that they have advised us up to this point on a lot of things. And also, granted, we're just a subset of the Board of Health, but Amy, when we just did that RFP for the embedded schools for the school year one, that just went to who? That just only went to us, or did it go to the Board of Health, or did it go to both?
It went to both.
Okay. All right, then forget it. But it worked, and then we just made that and recommended it to the Board of Health on that. But I think that it should just kind of stay within us at this point, because we also know and very much aware of how much money there is and what allocations that we might want to make differently and things like that. So and to go back and take it back to the advisory board after we've made it what we're going to advise to the Board of Health, it's almost like we need their approval, but that's not the ones that need to approve this stuff. It's the Board of Health that needs to approve it. So to me, going back after we go through and make a decision on what we think we should fund and the amounts, I don't think that that's the right path either.
I will just say, and again, I'm really, as always, I'm asking, not telling. I will just say that this is really changing their role then, because for the past, I believe, well, since their inception, they have very much looked at the applications, every application, and weighed in on even how the money should be allocated. I mean, we literally have taken a chart which showed, you know, like the total amount of dollars to be allocated. We started with that. We started with then looking at how much each application was asking for, what categories they fell under and met, kind of looking at, you know, percentage of what do we want to make sure we've got covered in terms of youth services. You know, we've always kind of looked at the categorical stuff. And then the Mental Health Advisory Board spent an entire meeting literally kind of deciding how to divide up the pot of money based on the applications. So they have had a very hands-on central role in doing that every year since their inception. And then they have taken that recommendation and given it to the Board of Health. So what's different is this group. By us inserting this group, we've added a different element that was never there before. So it's almost like this group has taken the place of the Mental Health Advisory Board in terms of advising the Board of Health. So all I'm saying is I just want to make clear that if we take the Mental Health Advisory Board out of making any direct decisions, we're just changing their role. And I don't know what the bylaws say about if that is, so I just want to make sure that we know this is a big change from their inception.
I think Carla had her hand up and then Judy. Carla?
I'm coming. I'm concerned about how we would handle conflicts of interest, because I agree with what Susan said. If you have group people on the Mental Health Advisory Board who are competing for the funding, they shouldn't get any of the, if they're competing for funding in, let's say, adult services, they shouldn't get any of the applications in that area. Period. I mean, that's not legal.
Which is why last year when we divided up into small groups, that took that off of the table, because anybody that had a conflict was not put anywhere near some of the applications. So you're right. So and I will also say anybody that had a conflict took themselves out of it. So, but I agree. It's just suddenly it's got much messier.
Well, we
So
have
last-
new members too. We have more members on the Health Advisory Board who are more actual people out in the community. Before we had the police and fire and, you know, regional office, they were not even going to remotely apply. So I think we have new people. Yes, Judy.
Yeah, no, I just was going to underscore the historical factors here, and that is when we would bring in previously, so last year we would bring in the potential grantees, and they would make an oral presentation. Members of the advisory board were always in attendance, not the entire membership, but there were always a smattering of some of them. So I think that we need to be cautious and kind of work through, and as Carla has cautioned us, and try to work through how we deal with those who may have a conflict. And I think there probably is a way to do it. But if we take them out of the loop altogether, we have just eliminated a number of years of history that we better be prepared to respond to that if we do so.
I'd like to ask, or not ask, but also put in there about the conflict currently, but there could be future conflicts with if you have someone that's on that board, and I don't even know, can't even remember who's all on that board. But anyway, in the future, there could be somebody on that board that then would be the next year they're going to do that kind of funding, and these are the kinds of things that they're looking for, and this is that, and this is that, and this is what they said, and that got them some money or whatever. And I just kind of I have a big concern about that with conflicts of interest.
mean, at this point, the people who were on the board last year are the chiefs. Am I correct in remembering was on the mental health advisory board last year?
Dan Deneen, the two police chiefs, Diane Wolf, who started out as the regional office and went to District 87. So she had to remove herself from some discussions when we were doing embedded schools after she moved from regional office of education. It was also,
It was both the fire chief and the police chief of Normal.
and again,
Yeah.
like I said, Dan Deneen, Diane Wolf, and there was always a county board liaison, so which now is Lori Woolrab, but before it was different people from the county. Trying to think who else are those Constance. I got it right here
We
somewhere.
had some ISU people, some folks that were involved in that area, as well as we had an ISU retired professor who had a son. She represented lived experience on the advisory board.
Okay, so we also had, let's see, I guess that's the only ones that were, I think that was it, with the constants that I've already mentioned. So this year differently, we have, and Diane Wolf has since resigned, so she's no longer on that. So now we have Dr. Christine Strauss, who is a forensic clinician. We still have Dan, we still have Rick Bleichner, we still have Chief Moore. Gabby Bonte is a Salvation Army shelter case manager. Mary Campbell, of course, is a retired ISU social worker and obviously person who's put a lot of wonderful things into the service system. Lori Woolrab from the county board. Sharon Fitzer, who is a public service administrator. Martha Dittmer, who is a IDOC parole agent. And Faye Freeman Smith, who is with a licensed clinician who is with Heartland Head Start Counseling Center, or I'm sorry, yeah, Heartland Counseling Center.
Can I just real quickly add that last year was when we added the conflict of interest statement that everyone was responsible for signing. And so then where it states in there, if you have conflict of interest as according to the bylaws, kind of like what Corey was saying, then you wouldn't vote or you wouldn't be part of that discussion. And so we've had conflict of interest from the advisory board the entire time. Well, I've only been at the health department for 2 years. Even as Corey said, with Dr. Diane Wolf, she was applying also for embedded school projects. And so then, and received funding for that. So when it was part of that discussion, then she would excuse herself from that discussion. So when you,
Which I also do from Baby Fold, which I always do from Baby
so
Fold.
when you have people on like the mental health advisory board that are providing advisement on mental health, behavioral health, they're getting their advisement from a lot of their advisement is from their professional experiences and some from their family experiences or personal experiences, but it's from working out in the field. And so there's not going to, in my opinion, there's not ever going to be a way to say, if there's a chance of a conflict of interest, you can't be on this board, because then we're.
And that is not the point, Amy. The point is when you put out RFPs and you're awarding funds, there's a difference there, and they're also making the policy on how you distribute those funds. And you can have people who is it going to apply? Who's told us they're going to apply for funds? This is the first I've heard of this.
No one on the mental health advisory board has said that they're going to apply for funds.
Or they said that she did something.
I was wondering, just out of some of the questions that were being asked, I just wondered if there was any, like, again, this has not been stated any way, shape, or form, but I just wondered if, for example, Salvation Army might do something. And maybe Amy, you can say to me, I'm totally nuts. But also Christine Strauss seemed to be extremely interested in figuring out, how
How to apply for funding.
populations that she represents. And it might not be anything that she is a clinician, I don't think associated with an agency necessarily. Well, I guess she is with an agency, but I mean, I think she was thinking more about maybe encouraging people that she knew serviced clients that she sees to apply. Does that make sense? So she herself might not be applying, but she might be hoping that other entities that serve the people she serves might be applying. So I don't know how that, I'm getting really indirect here, but I don't know.
Well, how about this? Why don't we seek an opinion from the legal department? Rather than us trying to sort this out and say, before we get, and then obviously if there's an issue with the board, I don't know how many of these folks believe or want to be involved in the process, and they may be as happy to not have to sit there and slog through it. But, I would feel more comfortable at least getting some guidance from the state's attorney's office on whether it's appropriate or not.
And Amy, am I nuts that I shouldn't have even gone there? I mean, do you have a sense that anybody might be applying from an entity? And I don't want to make a problem where none exists, but I also didn't want to ignore that possibility.
Well, we have to be, and I think we had a little bit of an issue on our other board, the Developmental Disabilities Board, with some of the board members. And I think that's where you run into problems, is that people, maybe they're not directly, but as you said, say, I know somebody who might, and then you're reviewing the applications and maybe this is somebody. I mean, obviously we all have that potential.
Mhm.
But I just, I appreciate that this may be changing some roles of people, but I don't know that it's unnecessary. I mean, I think we've certainly asked for, and I think, for example, why don't we ask the Mental Health Advisory Board to help with some of these issues we've talked about this morning about, come back and to meet with us about the marketing plan and come back and help us figure out how the resources that are out there can be better advertised and people connected and,
Mhm.
instead of
I'm sorry. And that really underscores their advisory role. I don't think it says anywhere that they advise us exclusively on funding, but they advise us on the services. So it may be if we remove this, that we really kind of beef up and put down in language what the expectations are. And we're already naming some additional advisory capacities.
Can I just get clarification real quick on what you want information from the legal? If it's appropriate for the MHAB or inappropriate for them to look at the proposals as a result of their role in the community and being able to access and see information from potential competitors?
Yeah.
Or am I missing something?
No, I think that, and also whether or not there's an issue having them make recommendations on the award of proposals too.
Uh-huh. Yep.
But I mean, I thought that was part of why the entity was formed in the first place, was to help with that, because that was what we were being told, was that we weren't doing a good job. The Board of Health wasn't doing a good job with determining who should get funded. And so they wanted these experts to be a part of that decision. So I'm just confused because I think we're sending, again, I'm okay, kind of, I can see both sides of it clearly, but this is a big change from what they've been doing.
Susan.
Before I speak, I think Carla had something she wants to say.
I was just going to ask Amy and everybody else I am really concerned that if they are associated with someone who is putting in for funding, because there's a tremendous amount of interest in the court services and the adult services. If they've got someone, they're just like you, Corey, you shouldn't be excluded from the conversation. You should not see, not you, but someone who is on the board is funding, they should not even see the other proposals. And they shouldn't be voting on the funding for that funding area.
And just real quickly, that has been, since I've been here, like when there was a conflict of interest, and I hate to keep using embedded schools, it's just the easiest. But they didn't, anyways, they would not see any of those applications, and they wouldn't have any feedback or voting or anything during that process. But then other applications that didn't apply, they didn't have conflict of interest, then they would have input in those areas.
Okay, so my comment here too is when we're talking about the Mental Health Advisory Board, they were created to advise us as to more what are the needs in the community. And so they have done that, I believe. And it didn't really say that they were going to necessarily, I don't believe, advise us on funding other than you should fund these areas maybe. And I think that that's kind of how it was done. And so then what, I can't even remember who said it about adding, giving them more advisory roles like in the marketing and things like that. What other things that can they advise us on that we should be looking at? If it's marketing, or if they're advising the Board of Health to do more things in with LGBTQ or something like that, any Board of Health programs that have that mental health aspect in it, that kind of thing. But I was kind of under the impression when it was created is that they were supposed to let us know what was going on in the community and what needs were there and what we should be focusing on. Not so much necessarily you need to spend, X number of dollars here and X number of dollars there.
And in fact, Susan, if I might, you're exactly right. I was fumbling here to pull out the statute, and I can read you exactly from the statute. It says, therefore, all terms shall be 3 years. The advisory board shall meet at least twice each year and provide counsel, direction, and advice to the County Board of Health in the field of mental health. That's all it says for their, in state statute. So it's very broad, and it's sort of as Susan has been saying. So maybe it's a time to,
Yeah, I
take
mean,
another look at that, and some of the suggestions that have been come under the advising and the counsel relative to mental health, and it doesn't mandate them or us to allow them to participate in the financial allocations. But we have the history, so we just need to be sensitive to that.
I love the idea of using them as helping really build some bridges to the people they serve, helping us figure out what are ways to better get help, and create greater access, reduce stigma for the populations they represent. I think that's fabulous. And I think that would be a fabulous use of them. And I think that's a great trade-off for, instead of helping us decide how to spend our dollars.
Yeah, that whole marketing function.
I
Good.
do think as this gets more and more complex, the fact that all of us now have some shared context, like I said earlier, I just think that's so important, because I think when you start having different people making decisions that haven't heard all the same stuff,
so here's my suggestion. I think that the consensus right now seems to be back and have the application, bring it back in our committee. And if you feel like, oh my God, this is gonna, I expect they will not be too torn up, because it's a lot of work. And their people are not afraid of hard work, but we want their brains for the policy and the decision-making, and not the tedious, did they hit this point sufficiently on an application? So I'm gonna suggest that we go ahead with this and let you, Corey, kind of vet it with the group. And if, let us know if you get some strong pushback or whatever. As I said, I think it'd be a good idea to have legal weigh in and say, there's sometimes a conflict of interest that can't be resolved. So this may be that type of thing where they're seeing things that give them some possible competitive advantage, or yada, yada, yada. So I guess as far as today, it sounds like the group is thinking that it's appropriate to bring it back, just have the committee review the applications this year. understanding the history. I mean, some of that history was born out of this group needed to be formed and hadn't been since the beginning of when we passed the referendum. And I think it's been finding its way since that time, and we're making progress as we go.
It only took us 10 years to put them in place.
Right. And I think some of what you described, Corey, was kind of fitting into a void without going into too much detail. I think you know what I mean.
No, I agree. But I do think this committee has kind of moved into that function that
Right.
have been assigned to the Mental Health Advisory Board. And I don't think it's at all bad that we have this function because, again, we have that shared context now, which also includes knowing our strategic plan, knowing, all of that, because I think that all has to play into it as well.
Yeah. So I don't know where we are, and we've certainly gone long on our meeting here. So
Can I just quickly clarify what I need to do is check in with legal, and I think I missed something that was heard. It was kind of cutting out as far as we're not sure if MHAB is going to be part of this process this year, depending on what legal says, or did you guys say, no, they're not part of this year? I'm sorry, I missed that part.
I think that I'm getting a sense from our group that we are ready to say to MHAB, get a well-deserved rest from this, and we will take over from here
Okay.
and not have them application.
Okay, perfect. So I'll still reach out to legal, and then I think I heard, Corey, you were going to reach out to MHAB to just let them know about this change in the process, and I think that's what I heard.
I think I'd like to also, what I wish that we could do is, I'd like to further define the role that they might have in helping us with this, like marketing and accessing, underserved populations. So I wish I could kind of put them together, because I think it says to them, we still value you, but we want to use you in a different way. But I don't want to get too far ahead of this group if we're not going to talk about that until September.
Yeah.
So
If I could just, Corey, and just a really quick side note is they started talking about that 50,000, the 225,000s. And we haven't gotten very far because the funding has taken so much of MHAB's time too, that like, I agree with you guys, like this would be the perfect time to say, all right, we have enough people doing this. There's not as many conflict of interest. It's not as gray or muddy, but you guys are out in the community. And so like, that would be like, so in September when we meet, like that may be the perfect time to really hone in on that 50K and the advisement on what to do with that. So I'm actually excited that maybe that can be a perfect time for them because we haven't been able to dig into that, and that may be the perfect time to dig into it.
Mm-hmm. And it's kind of the optics that, we don't hit them with, okay, thanks, we're not going to let you participate in allocation this year, but we come forward with, here is another excellent opportunity for you to provide us with advice and counsel, and sort of
Right,
lead with that.
And you guys aren't doing that right now. So it would be like not doubling the work of both committees doing the same thing.
Yep. Got it.
And also follows, because last year they gave the advice and recommendation that there'd be money appropriated to do this type of thing, which we took their advice and added it in the budget. And so now we're asking for their assistance in implementing this. So it sort of tracks, I think, the role is.
And when can that money actually be starting to be tapped into? Is that, because it's been allocated for a year, so it's actually.
We can
available
tap
now?
into it. It's
Right.
now. It's in calendar year 20's budget.
Okay.
And Jessica McKnight is actually asking me what is going on with it. So to have some plans, even if that money has to be allocated and some of it dispensed in 21, but she's asking me like, what are you guys doing with this money? Because it was for 20, that would, sounds like an excellent.
So it's a one-time only? It's a one-time only, is that
There's some
correct?
logistics with, it's just 50,000 in calendar year 20. And there's some logistics, like if we at least know how we're going to use it in 21, then I can talk to finance about that, but we definitely need to make some plans.
And because it seems to me that it ties in beautifully with this 211 campaign, which is, and how, the coping campaign where they're trying to get the word out, like use path, et cetera. So that's the marketing, but then there's the navigation piece that we still haven't, even this group hasn't had much thoughts about. So again, navigation meaning, helping agencies really think about, have they tapped into collaborative relationships? Have they tapped into alternate funding sources? Have they, whatever it might be.
Yeah, and I think those are all awesome things to talk about in the September MHAB meeting.
What I was going to suggest is a joint meeting with Mental Health Advisory Board. That might be even all the better. If that seems appropriate to talk with them about that. You guys are all frozen, so you probably.
Say that again, Hannah.
Yeah, everybody looked frozen in my picture. So maybe we have a joint meeting with the Mental Health Advisory Board in September to start this discussion. And Corey, I think the money budgeted for 2020. If we get the program in place or know what's going on, then we'll just budget money in 2021. So that money the way the county board budget works is it just gets all spent and it then falls into the reserve and the next year we budget. It's not like you carry over money.
And I believe we asked during the budget session Corey and I had with Jessica and our finance people, they said the money's in there in the budget for 21. Didn't they, Corey? Because that was a specific question. Mm-hmm.
They did.
But now, yeah, okay.
All right, so I think we've covered a lot of ground here, and maybe this is a good time to end our meeting. Amy, you can, sorry, if your background noise is a small drummer boy here. My grandson.
He's got rhythm. He's good. He needs to hook up with Susan's musically inclined children.
Here, I turned off the camera, but anyway, you can get the there you are, Wyatt. And then you can see you, but get us the RFP so that we can make any comments on it. And I guess we've decided that the scoring will be handled by us. And is there anything else we need to decide today? Amy, from your perspective.
I move we adjourn.
Second.
Okay, so I think we're adjourned, right?
Yep. Good
All right,
work,
thank
gang.
you. Great discussion,